38 degrees, and we could get up to 50 tomorrow. But here it is, 16 after 5. And we're going to talk now, as I told you earlier, with Dr. Steve Thom of Eye Consultants of North Dakota. And this is the first of many visits, I'm sure. Dr. Thom, welcome to the Drive Time News Hour.
Thank you, Jack. Always a pleasure to be with you.
So, how long have you been an eye doctor? And there's probably a better term for what you are in that regard.
About 30 years now.
Wow. And why did you choose that field of medicine?
Well, I went through medical school and got exposed to all the different specialties and found that I liked a lot of them, but I was kind of drawn to ophthalmology in the eye because it gave people such a chance to really improve the quality of their life in a very quick manner. Some of the specialties, it takes weeks and months to get better, and I enjoy a quicker fix, and so this felt like the right fit, and I've sure enjoyed it.
Well, I've been seeing you for quite a while, and after all those visits, what tipped you off that perhaps a cataract removal would be a good idea?
We typically recommend cataract surgery when the vision has declined to the level that it's affecting your quality of life. It's affecting what you can do. Sometimes we're forced to do surgery sooner than other times based on the patient's other medical conditions or even other problems, in the eye, such as glaucoma or macular degeneration or a vein blockage in the retina, things like that. So sometimes the eye tells us when it's time, and other times the patient tells us based on how their lifestyle has been affected negatively.
What causes a cataract to form?
That's a great question. Basically, just birthday candles. The more candles we get, the more likely we are to have a cataract. It's an oxidation or an aging process of the eye, and there's certain diseases that we may have, systemic diseases that can make that occur quicker, such as diabetes. There's also other risk factors like steroid use, whether it's orally, IV, topically, that can propagate cataracts quicker, or cigarette smoking is also another big risk factor.
I would imagine, in fact, I'm sure that how cataracts are treated has changed dramatically in your years as in that field.
It definitely has. A simple definition of a cataract is a cloudy lens inside the eye. And the cloudier the lens gets, the less well we can get light in and to the back of the eye, to the retina, and the less well we see. So as the lens gets cloudier and cloudier, our vision gets worse and worse. And so the way we fix cataracts is we take out the natural lens of the eye that has turned cloudy, and we put in an artificial clear plastic lens to restore the sight. And the taking out of the lens and putting in an artificial lens hasn't changed since the 1950s. That's how we've had to take one out and put one in. What's changed is how well we can measure the eye, how quickly we can take the cataract out now, how small an incision we can use now, and the type of lens implants we have available to correct farsightedness, nearsightedness, astigmatism, things like that. So the technology has really improved over the last 30 years of my career.
Do young people develop cataracts to the point where removal might be suggested?
They can, and especially if they have some of those other risk factors I mentioned earlier. But truth be told, people can be born with cataracts. They're called congenital cataracts, and occasionally babies, just a few weeks or months old, need to undergo cataract surgery because if you don't get light into the retina at a real young age and get it in a focused fashion, you won't develop normal vision. So, yeah, they can happen at any age, but typically most people are in their late 60s to mid 70s when they experience their symptoms and have to undergo cataract surgery.
Everything looked kind of brownish, like when the Canadian wildfires fouled our skies for me. Is that typical, or what do people tell you about their vision being clouded?
Yeah, most people just complain that they're having trouble seeing sharply. They can't read the small print on the television or the magazines or newspapers or computers, and or they're having trouble driving, especially seeing road signs or meeting headlights at night. They get glare symptoms from headlights coming at them, but they don't really perceive that their colors have been altered or that they're seeing things in a
Oh.
real brown fashion until after they've had the cataract surgery. And then it's an epiphany, such as yourself, where you say, I didn't realize I wasn't seeing those colors until you got them back. It's because cataracts typically develop over many years, and it's such a slow change. Our brain just keeps adapting, and we don't realize what we've lost until after the first surgery.
Dr. Stephen Thom, Eye Consultants of North Dakota. I can tell you the procedure was very quick. It was painless, and I felt completely almost at home during my procedure. Thank you for joining me, and I look forward to talking to you and some of your colleagues once a month or so over the next few months, all right?
My pleasure, Jack. Keep up the good work. You're a big asset to the Red River Valley.
See you. Dr. Stephen Thom of Eye Consultants of North Dakota. They're online. You can find them, and I tell you what, it's a great experience.